Before we begin, I just want to say I'm not a medical professional. I just think it's everybody's duty to be a good citizen, right? Um, Try to be effective in being the help until help arrives. So I'm trying to spread the word. Here's the disclaimer. What we're going to talk about today is we're going to talk about understanding, identifying, and stopping life threatening bleeding. So in these cases, the person's probably going to die before an ambulance can arrive. And so every minute counts. So your goal is to keep them alive for those extra few minutes. Now, the Stop the Bleed curriculum was jointly developed by multiple organizations in response to the Sandy Hook shooting and the Boston bombing. The goal was to provide the average person with basic skills and knowledge to go from helpless bystander to lifesaver in an emergency. Several lives could have been saved, and those and countless other incidents had people just known what to do. Now, this initiative has provided Stop the Bleed kits at organizations, lots of organizations all over the country. It's been covered by various news outlets, and over 3 million people have taken this training. Okay, so why should you care? Well, as of October 31st, a total of 621 people have been killed and 2,126 others injured in 520 mass shootings in the US this year. As of November 14th, that's 2 weeks later, that number rose to 602 mass shootings. We're on pace to reach 700 mass shootings in the US by the end of the year. There was actually one half an hour away from my house not too long ago at a place where I often go. Now, it's not just about mass shootings. Roughly 20,000 people died in traffic crashes just in the first half of 2023 in the US. That's 40,000 people a year. And each year, about 36,000 people are injured, hundreds fatally, in chainsaw accidents in the US. In all of these cases, the number one cause of preventable death after the injury is bleeding. And life threatening bleeding can happen just about anywhere, right? Your school, your church, out at the park, at a concert, whatever the case may be. So, while we're going to cover Stop the Bleed, I'm also going to augment it with some additional context and important information. So, triage, that's the process of assessing the situation and evaluating the priority of issues you want to address. So, there's a really common one, ABCs. So that's airway. Are they choking? Breathing. Are they breathing? Maybe they're passed out or whatever, unconscious. Circulation, right? But what we're going to focus on, because personally I believe in more in the March triage protocol. So it talks about ABCs, right? So it instead of breathing, it talks about respiratory, but it starts with massive bleeding and it ends with heat loss, and that's going to be the focus of today's video is massive bleeding. Heat loss also because when the person goes into when they lose a lot of blood, they can go into shock, and that in and of itself can kill them. All right, so to understand what massive bleeding is, let's just talk really briefly about what your body looks like. So you have essentially three main types of blood vessels. There's arteries, there's veins, and there's capillaries. So the arteries are taking oxygen-rich blood away from the heart. The veins are, taking the all the kind of garbage, if you will, back into the heart. And then the capillaries are where stuff is exchanged. There's also smaller arteries like arterioles, large or smaller veins called venules, right? So if you think of this as roadways, the arteries and veins, those are highways. The capillaries, those are kind of like neighborhood streets, right? So most of the cuts you're going to get are going to be capillaries. You cut your finger while you're cooking dinner, or you scrape your knee or something like that. Those are typically capillary bleeds, and just applying pressure on those is going to stop them. The other two, the veins and the arteries, those are going to require a little bit more. Okay, so keep in mind we have about 5 liters of blood in our body, and once we lose 1 to 2, it becomes serious, and this can happen in just a couple of minutes. That's why it's so important to take immediate action. There's 4 main areas of the body where bleeding can occur. Now we're going to discuss each of these in more detail, but this is a really, like, if you, out of every slide in this whole deck, this is kind of, to me, the most important one, right? Screenshot or whatever. Now the official Stop the Bleed training only covers the first 2, but I'm going to cover the last 2 as well. In addition, keep in mind that, like we said before, shock could be a real thing with blood loss. And so it's important, it may be important to keep the person covered with like a Mylar blanket or whatever you have handy. So these are the types of things that we're going to talk about today. And if you don't know what these are, then that's fine. That's why we're going to talk about them. I also recommend all of these things be in your first aid kits. Now, keep in mind these are all single-use items. Okay, well, I mean, maybe not the Sharpie, right? You can reuse that, but I mean, the medical things are single-use items, which that means that if you get a tourniquet to practice with, which is a great idea, don't put that in your kit, because once you've tightened the tourniquet, the windlass, that's that stick that's on it. Once you've tightened that, that tourniquet is now compromised. And so, maybe buy a cheap tourniquet, right? Like a $10 tourniquet for test, for training, practice and stuff. But then have a real and unused tourniquet in your actual kit. All right, so the goals of this training, basically two things. You want to identify life-threatening bleed and you want to stop it. And remember, we're not talking about like minor wounds. We're talking, oh my God, that's a lot of blood, right? So to begin with, make sure you're safe. Don't work on a busy street. Don't work in an active shooter situation. You want to try to move yourself and the patient to safety before continuing. If possible, wear gloves, but if you don't have any gloves, your skin actually does act as a pretty good barrier. Just be sure to inform professionals, if you did come in contact with blood. So in triage, the ABCs were airway, breathing, circulation. But in bleeding control, it's alert 911, call for help. B, bleeding, identify the bleeding. And C, compress, stop the bleeding. So remember, the whole purpose of this is to keep the patient alive until help arrives. So you want to make sure that help is going to arrive, right? Don't just assume somebody else called for help. Make sure that you call for help. And when you call, try to be concise when you're talking to the 911 operator. Hopefully you know your location. Like if you're in an office building, know what floor you're on and what room, maybe things like that. And follow the instructions provided by the operator. Okay, so bleeding. So if you look at this picture here, for example, that sucks, and I'm sure that really hurt. But that's probably not what we're talking about when we're talking life-threatening bleeding. Remember, life-threatening bleeding is, oh my God, that's a lot of blood. So on a wound like this, what I would call relatively superficial, again, it looks like it may be bad, but relatively superficial, pressure is probably going to be enough. But compression is what they're talking about. So oh my God, that's a lot of blood. What does that mean? Well, you're looking for continuous bleeding. You're looking for maybe arterial bleeding is going to be spurting. Okay. Venous bleeding is going to be like large volume, pooling of blood, right? Think about a cup that's been tipped over and the liquid's just pouring out of it. So those are the types of things that you're going to be looking for. And keep in mind a couple things. There may be multiple places where the person is bleeding, right? Like if they were shot, for example, there's an entry and maybe an exit wound. Same with, if a tree limb went through them or whatever. So you may need to roll the patient over on their side, so you can look at the back and assess for other wounds. And you also need to you may need to cut away clothing, right? Preferably with trauma shears, so you're not using a knife and like slicing the person apart, making it worse. But, so you may need to use trauma shears to cut away clothes and see what you're doing. Now, this is especially important, like if you're in the north and it's like in winter, so you're wearing these big, maybe really bulky coats. Some of these down jackets and whatnot can hold a liter, maybe 2 liters of blood before it starts seeping through. So if they've already lost 2 liters of blood, I mean, that's they're kind of on the border of being done before you even realize it. So be sure you if they're wearing jackets, take off these jackets. Make sure that you actually assess. Okay, so most of these areas are going to be done separately, and we're going to talk about each one. So the first thing you want to do, usually in bleeding, is try direct pressure, right? So this can be with gauze, this can be a t-shirt, it can be a towel. Regardless of what you're using, though, gauze, t-shirt, towel, whatever. Once you're applying the pressure, you want to make sure that you don't take it off, right? Because you're applying the pressure and you're trying to get the blood to clot. And if you pull the gauze or the t-shirt or whatever off, then the clotting is going to stop. It's going to stop that process, and you're going to have to start over again. And that clotting process typically takes about 5 to 10 minutes. And when we say pressure, for something significant, Like if you notice this guy, he's got his arms straight, his body's over it. He's putting his weight on that thing. So we're not talking a little pressure. We're talking really significant pressure. Um, Again, you're going to want to focus on where it's bleeding, and if the pressure does stop the bleeding, and it was bad enough that you called for help, don't let off the pressure. Keep holding that pressure on until help arrives, right? Because remember, you let off the pressure, maybe it's going to restart. You take off the bandages, maybe it's going to restart. So just keep that pressure on. Now, um, for large wounds, for you got some big hole, obviously, as you can see from this picture. Pressure is probably not going to be enough, right? So if they're bleeding from some kind of deep wound or whatever, what you're going to want to do is you're going to want to, like this picture. I mean, it's good, but it doesn't really tell the tale, because think about if you've got a straw going into a cup, right? And there's liquid feeding in through the straw. Well, if you put gauze over the top of the cup, that's not going to help, right? So with the straw, you want to keep the liquid from coming out. You either want to cover the end of the straw or you want to pinch the straw. So it's kind of the same way with your veins and your arteries. So the goal here is to put the packing in up against the straw, the artery, vein, whatever, the blood vessel, and then by packing it, that's keeping that pressure on that. So that's what we're actually trying to do. Okay, and now keep in mind this is going to hurt, right? This person's already hurt; they've got this big hole in them, and now you're shoving something into their body. So it's going to hurt. So try to keep them calm, right? So let's take a look at what I mean by that whole straw thing. So if you look at the straw, right, there's two ways, right? So you can either cover the end, that's what packing actually does, or you can squeeze the straw, and that's what pressure and tourniquets do. Okay, so let's take this pool noodle, this little piece of a pool noodle. Think that hole, that's the hole, that's in your body that you're trying to pack, and then the straw represents a blood vessel. So first thing you want to do is you have your gauze if you have it available, and then you're gonna want to kind of ball it up, right? So ideally, maybe put a knot in there or whatever, but you're going to be under stress. So make a ball so you can find the blood vessel and put that up against the blood vessel. And then if you notice while I'm doing this, I'm always keeping pressure on that spot. If I put my other finger in there, then one finger is always keeping pressure on it. Don't just start packing the wound. You want to have pressure on this blood vessel the whole time that you're packing everything. Okay. And now, once the packing is done, you're going to keep applying pressure. So, I mean, this whole roll of gauze is going to, and more will fit in there. That gives you an idea of these wounds. So, once the packing's done, you're going to want to keep applying pressure on top of that. And if you can't manually apply pressure, then an Israeli bandage would be used. So Israeli bandage, first take it out of the wrapping. So it's basically just a big bandage with wrap on it, except for the one thing that you just saw. So let's say that spot right there where I'm pointing is the sore. So you put the bandage over it, you wrap it around once, and then this item right here, you're going to go through that, go underneath, and pull back the other direction. Right? I see some people that just keep wrapping, and you don't do that. The whole point of this is you want to pull backwards. You see, as I'm pulling back, see how it's bending it over? That's what's actually putting the pressure on the point. So you put that pressure on the point. If you needed even more pressure, you could twist it while you're wrapping it. So you wrap it all around, and then at the end you'll have a couple of clips. And so you put the clips right there, and there you go. Now you've got pressure there. And these can be used for a lot of different things in a lot of different places in the body. So again, wound packing is probably going to be the first choice for the sides of the neck, right? Not the front, not the back, but the sides of the neck, the armpit, and the groin. The tourniquet is probably going to be the first choice for the arms and legs, but you can also do some packing there as well. One thing to keep in mind, you do not want to pack the torso, right? You don't have enough gauze for that, first of all. And you don't want to pack the head either. But it's unfortunate, but so for the chest, you can use chest seals. We'll cover that. For the abdomen, honestly, there's just not a lot of good options, right? I mean, maybe you could use the chest seals to kind of slow down the blood flow or maybe help with infection. Chest seals could also work for like a wound in the front of the neck. But the main thing is you're going to want to get them help just as soon as possible. Now, tourniquets have gotten kind of a bad rap, right? The patient's not going to lose a limb just because you put on a tourniquet. It can be left for several hours without getting, any lasting damage, but you do want to get them to the hospital as soon as possible. Now, how many hours can it stay on? Two less than 2 hours. That's pretty safe. I've read articles where it's 4 hours, 6 hours. Um, there's been things where as long as 8 hours and they were fine. I wouldn't want to push it, right? Now, that's why it's important to write the time and whatnot, and we'll talk more about that. But so if the tourniquet doesn't stop the bleeding, um, you want to tighten it. So in the cats, like we'll give an example, you'll just turn the windlass more. Okay. Now, if that still doesn't stop the bleeding, you may have to apply a second tourniquet above the first one. This is typically going to happen like in a leg or something like that, right? So remember, what a tourniquet is doing is it's pinching that straw. It's closing off, pinching that blood vessel. And so the leg, there's a lot more meat there, right? There's more muscle and fat and everything else, and so it's going to take a lot more pressure. You can do it over clothes. The thing to keep in mind is that, this is going to hurt, right? All these things that we're talking about, the person's already in pain from the wound. You're putting direct pressure right on their wound. It's going to hurt. You're wound packing. You're literally cramming things into their body. That's going to hurt. You're putting this tourniquet on their arm or leg or something and restricting blood flow through their whole limb. All these things are going to hurt. That's normal. Okay, so if they say, "Oh, that hurts," then just make sure that they know that it's normal, and just try to calm them down. So as to where you want to put it, you want to go for about 2 to 3 inches above the wound. If you're not sure exactly where it's at, right? So maybe they're wearing jeans and you don't have a way to cut them off or see exactly where it's at. Then typically what you'll do is you'll go what's called high and tight. So meaning you place the tourniquet at the top of the arm of the leg. So you want to be sure to write the time of the tourniquet, not only on the tourniquet but also write it on their forehead, right? You want to make sure that nobody misses that. And the reason you shouldn't remove a tourniquet once it's in place is that, remember what's going on. Your arteries are like the Amazon guys. They're delivering the packages. They're the yay, we're happy to see you. And then the tourniquets are, not sorry, tourniquets. The veins are like the garbage disposal guys. They're picking up the waste. They're picking up the trash, everything else, right? Well, once you put on a tourniquet, you're no longer sending all that waste back to the body. So those toxins are building up in the body, and you're not going to have the right medications to counteract that. And different protocols are going to be used depending, right? If the tourniquet's on for half an hour versus 3 hours, they're going to use very different protocols, different sets of medication. So that's why it's really important that you put the time so they'll actually know when when it was applied and what protocols to use. Now, there's a lot of different kinds of tourniquets out there. To be honest with you, the one that I recommend, the ones that I use, are CATs. So it's Combat Application Tourniquet. It's actually Generation 7 is the latest one. So the reason that I trust those is the Army. That's pretty much the only kinds that they use. Police, right? This is the most commonly used one. But again, like I said earlier, make sure that you get an official one. A cat tourniquet, a real one should cost about $30, right? You go on Amazon, it's like $30. You can go on Amazon and find them for $10, and they'll look just like that, but they're knockoffs. And you can go on YouTube. There's tons of videos of people doing stress tests. The knockoffs are going to break first. This is a life-saving piece of gear. So spend the extra money and get a real one. So when you get to tourniquet, first thing you're going to want to do is you're going to want to freeze it. Okay? Make sure the application of that tourniquet in emergency goes as quickly as possible. So you're going to make that hole. You want to get this contact out of the way. You mind fumbling with this? Now I'm sitting by the pool. I'm relaxed and I'm fumbling with it. Can you imagine if your hands are all smeared with blood shooting from somebody's body? Your heart's pumping. Like, you want to make this as easy as possible. So tourniquets can be put on somebody else, or right here, here's an example of self-application. So the goal is you want to get this thing as tight as possible, right? But then once you've done that, then you spin this windlass, and that's what gives you a mechanical advantage, and that's going to really tighten it. Probably typically like 2 or 3 spins is going to be enough, but you know it's enough when the bleeding has stopped. If there's still blood coming out, tighten it more. Once it's done, you put it in a spot, to hold it. You wrap the rest of the tag around, and then you put the time on it. So you want to write on the time. Remember, you want to write on the forehead as well. Okay. And remember, this tourniquet right here, I use it for training. I use it to train my family. Using it for this video. This tourniquet stays in my office. It does not go, anywhere. This has been compromised. Once you've used a tourniquet, do not use it again. All right. So the thing is to keep in mind, most commercial tourniquets are going to be too big for infants or really tiny kids. That's the bad news. The good news is that their blood pressure is usually so much less than adults, right? And their limbs are so much smaller that direct pressure with your hands is probably going to be enough. There are other things like wrapping your Israeli bandage really tight could make it into a tourniquet. There's something similar to that. It's called a SWAT T tourniquet. So there are some things, but honestly, the pressure is usually going to be enough. Now, if it's a really deep wound, you can do the wound packing, same as on adults, right? So this and the next couple slides are not part of the stop the bleed training, but I feel that they should be addressed. So for the chest, you're going to want to use vented chest seals, and I'll talk more about those in just a second. So one thing to keep in mind is in cases of like a gunshot, right? You want to look for both an entry and an exit. That's why chest seals usually come with two of them. You can also use it on the front of the neck as well, right? So chest seals are basically just like big stickers. So I mean, really, really sticky, and they're strong. I mean, it's oversimplification, but that's essentially what it is. So you're just patching something up. If you don't have a chest seal, you can actually improvise one, and I'll talk about that a little bit more in the next video. Um, you, and if you don't have anything to improvise with, you can actually, worst case, use your hand to cover the area. It's probably going to be effective. So here's the back of an actual chest seal. So you see it. It's just a big sticker. So the first thing you're going to want to do is try to just wipe off the area. Right, it's probably all covered with blood and dirt or something like that. Now these will stick through that. I mean, this is their purpose, is to stick. So they'll stick through blood as well. But I mean, you want to make it as easy as possible. And so then you're going to grab the tape, just take it off, get a sticky part, put that over the wound, seal it up. Right. So think of you're patching an air mattress or something, or sleeping, some kind of air sleeping bag or whatever, and you put some little sticker on there, and then that's what you're doing. Okay. Now, the reason it's called a vented chest seal is you see these on number 3 and 4. You see these like 3 little pathways, right? So those are the vents. So keep in mind what a vented chest seal is about. It's not about stopping massive bleeding. All right, if you're like shot in your lungs, bleeding is not your problem. The problem is your lungs going to collapse and you're not going to be able to breathe, and you're going to die that way. And so what the chest seal does is it covers that up so that your lung now can inflate, right? So when your lung is inflating, it's sucking on that chest seal, on that hole, and no air is coming in, and so the lung is doing its job. Now, when it's deflating, it's blowing air out of the lungs. Yeah, some will go through your neck and mouth and nose and stuff, but keep in mind, there's presumably, because you're doing this, there's a hole in their lung, and so it's also going to put air into their body cavity, which is no bueno. You don't want that to happen. So the vents allow for that air to vent out, right? Now, if the person looks like they're bloating, or looks like you can tell the air is building up, then you may need to what's called burp the chest seal. So pull up a corner, pull it over that hole, and just let all that air come out. There's other ways to do this, but I'm not going to get into those. Now, I said you could actually improvise one. Yes. So let's say you have a plastic bag. You would do a plastic bag, and you would do it on 3 sides, the top and then both of the sides. Leave the bottom not taped, right? So tape the plastic bag on 3 sides, and then the 4th side, that's going to work as you're venting. Now, for the abdomen and the head, like I said, there's not a lot of great options. I mean, don't wound pack either one. Pressure, depending on where it's at and how bad it is, pressure may help. The chest seals may slow your bleeding, but basically just get help as soon as you possibly can. So frequently asked questions, impaled objects. You got a knife sticking in you, or a big shard of glass, or a tree limb, or something. Now, that impaled object, it might be lodged against an artery or vein. So taking it out may do more harm than good. What you want to do is you want to immobilize it, right? So if it's this jagged piece of metal or something, you don't want it just flopping around and just making, tearing up everything that's inside your body. So you want to immobilize it, maybe, by wrapping gauze around it, maybe a shirt, taping it up. Make it so that it doesn't move. Don't take it out. Let the hospital take it out. Now, if an eye is impaled, you still want to immobilize the object, um, but you're going to want to cover both eyes, right? Try this: close one eye and then look around with your other eye. You'll feel your closed eye moving, right? So even if one eye is fine, you want to cover both eyes to keep them from looking around. Improvised tourniquets, they can be effective if you really know what you're doing. The problem is most people don't. And so that should not really be your first choice. Like if you've got other means available, like wound packing, that's probably going to be your first choice. Um, Now, if you lose an arm or a leg, and for some reason it doesn't look like it's bleeding that much, it's a weird thing that the body does, right? So it's restricting the blood flow, but there's going to come a point where that restriction stops, and then blood just going to start pouring. So even if it looks like it's not bleeding, still put the tourniquet on so that when the floodgates do open up, it doesn't, just drain the body of blood. Now, like I said before, all these techniques that we're using are going to hurt, right? And so that's normal. And just be sure to explain that to the people. Make sure you keep them calm. So, to summarize, you want to worry about your personal safety. Okay. If you're injured, not only can you not help the other person, but now help needs to help multiple people instead of just the one, right? You want to call for help. You want to look for the bleeding. You want to stop the bleeding, right? So that's by using compression. Like think of the straw. You're either putting pressure on, or maybe using a tourniquet. That's like pinching the straw, or you're wound packing. That's covering up the end of the straw, and you want to keep that pressure going until help arrives. So, stopthebleed.org is a great resource. Go there. There's a whole bunch of information about this topic, and you can actually sign up for free training. I believe it's still free. Free training. So, I appreciate your time. I hope it's been useful to you. Remember, the best thing for you to do is take a class and be prepared, because you never know when you're going to be the help until help arrives.